Welcome back to another episode of Southern Indiana Now. Thanks for joining us. We've got a great episode. We're going to learn more about Indiana Health Center in Seymour, Indiana. They've got some exciting things happening, and Stephanie has joined us, so we'll learn more in just a moment.
This is hustler country, a place where people earn their keep and make an honest living. We build machines that last because they have to. We make it, we test it, we break it, and we do it over and over again. So visit your local Hustler dealer and join us, because we are Hustler.
The area's best selection of Hustler mowers is at Southern Indiana Equipment in Lanesville. Shop online at southernindianaequip.com.
So thank you for being here. Excited to learn more about the Indiana Health Center, and it's Stephanie Kendall. So thank you for joining us.
Yes.
And tell us just a little bit about the health center itself. If somebody is unfamiliar with what it is and what kind of purposes it serves, can you give us just a quick overview?
Yes, absolutely. We are a federally qualified health center, so FQHC, and we are serving Indiana for over 50 years. Since Jackson County's been here, we've been serving it since 2004. This is the third location that Seymour's practice has been at, actually, which was our former founder, Elvin Plank. That was his vision. And now our current CEO, Ann Lundy, is our person that we report to. Absolutely would have loved to have met Elvin.
Yeah.
And I've actually had a really pleasant experience with Ann Lundy. So I am happy. I'm really excited to be able to be a part of this community and to help grow and help, I guess, with everybody's expectations.
Yeah, well, it's great to have, the health center here.
Thank you.
It's been a great resource. I worked in the community agency building for many years while it was there. So to see its new home, newish, maybe
Yes.
improved, it's been really exciting. And I know that I'm sure the founders would be proud of where you are now.
Well, thank you. Yes, absolutely. I'm super excited and blessed to be able to be in the position that I am in today.
Great. So what is coming on August 6th? Is that the date?
Yeah,
Tell
it
me.
is I'm going to show it so
Oh, yeah.
everybody can see. It's our Whole Person Connection Hub grand opening. We're just wanting everybody to join us August 6th at 10 o'clock. We're welcoming new patients. We're also welcoming our current patients and anybody in the community that wants to come out and see what we are offering. With the expanded new renovation with dental on the second floor, we went from having 4 chairs to 6 chairs, and we moved our behavioral health offices. So we will have 2 behavioral health offices instead of 1. And
Wonderful.
then our psych office for our psych doctor, Dana Weaver, and coming soon, pharmacy, and also coming soon, chiropractic in that area.
That's wonderful. So it is whole body.
It
You've
is,
got
yeah.
everything.
Yeah.
What a great expansion. I know mental health care is something that, some people have a hard time finding, and having expanded access is really great for our community.
Yes.
So the dental clinic, how does that work? Do you have to have any kind of dental insurance, or do you come in, like what do people need to know if they're
Well,
going to
we
come in?
welcome all patients with insurance, without. We also have a sliding fee scale that we are able to use because we are grant funded. So patients would bring in, their W-2, and we could get them a sliding fee scale for a year.
Okay.
Or they can bring in their last 30 days or 60 days to get a 30, 60, or 90-day voucher based on their household size and their income. Then we would be able to tier bracket our services at a lower cost.
Great.
So
And that's, health insurance. If somebody has it, they can come there. You'll
Yes.
accept probably most.
we accept all insurances.
Oh, well, that's great.
Yeah, and as well as, even if they have insurance and it doesn't pay for everything, if they qualify for a sliding fee scale still, that lowers the cost for them, and they may only have to pay $20.
That's wonderful. Great resource for people who, some people are just getting by. And if they can
Yes.
get help and get a hand up with healthcare, dental
Yes.
care, mental care, and even chiropractic, and what else? You said one other
So
thing.
we have medical. So we also serve our adults with medical. We have got several physicians in there, actually. So we have Dr. Karnick. She is our medical doctor. She does a lot of MOUD patients, as well as your normal diabetes, your day-to-day routines. And then we have Caitlin Taylor. She's a family nurse practitioner. We have Tabitha Pina. She's a nurse practitioner. And then we have Erin Daniels, who is OB and nurse practitioner. Tessa Ray, she is a nurse practitioner. And we have Dr. Carnero, who is our pediatric doctor. She actually hired in with me.
Wonderful.
So we have every service available, as well as offering the mental health side of it with psych.
Yeah. I didn't even think about peds, like about children. That's
Yes.
great. So it's a service for, any age can
Any
come
age.
in, any income.
Newborn to, I would say, older adult, and into life services. Yeah.
Wonderful. So is there anything else you'd like to share about the practice? How could people get in touch with you or the practice in general? Is it best to schedule something ahead of time, walk in? What
so
works
we
best?
offer everything. So we do have walk-in availability. So if you're a new patient and you have to walk in, obviously, I think we would probably have to next day you, unless, the provider is able to see a new patient, because those appointments do take longer. We have to get, their summaries from other hospitals, as well as getting their insurance and their paperwork signed. It can be pretty lengthy. So if the provider had an opening at that time, it took too long to be able to do the paperwork. But we always try to see the patients the same day if possible and work them in. Our providers are all about meeting the patient's need, especially if they walk through the door. They don't want to turn everybody down or anybody down. So I do my best to get people in too. And I know all the other team leaders do as well.
So what's the website? What would be a great place for people to go search and find it?
IndianaHealthCenters.com.
Okay.
IHC is where we are. And we have a call center if we're not there after hours, as well as, just walking in and scheduling. So I don't know. I think that it gives a lot of people the opportunity. I've actually had someone travel like 2 hours just to come here to IHC because of her tooth and not being able to have the services of another provider at other offices on a Friday. And we were able to get her seen that day, and she was a new patient. So
that's great.
Yes.
Well, thank you. And thank all the people there, the good people working there. And if you don't know about the services they offer, August 6th would be a great time to stop in.
Yes.
Learn, kind of see things, meet people. Kind of an open house feel.
Yes, absolutely.
And learn more about it. If you need the services, get in there. Check out the website. But Indiana Health Centers, and thank you, Stephanie, for being here. And thank them for everything that they do. We'll be right back. Hope you enjoyed this week's episode of Southern Indiana Now. Thank you to Southern Indiana Equipment for sponsoring this episode. And we look forward to seeing you again next week. If you have any topics, suggestions, comments, concerns, questions, just about anything, send us an email. We'll get in touch. Thank you for joining us. We'll see you next week.